Hi everyone, welcome back to this wonderful show. Today I've got with me Scott Harrison. He's the VP Chief Data Officer at Parkland Health and Hospital System. He's based in Dallas, Texas. Scott, thank you for coming along to the show. Welcome along.
Yeah, thank you, Jason. I appreciate you having me.
No problem. So we're going to talk about the use of data in delivering healthcare in the US. Obviously taking some stories from your time at Parkland, but I'm sure an illustrious career in data and other things. So let's get into that. Why don't we start with a bit of an intro about you and your background in data, and also just a bit about Parkland as well and its history, and that'd be great to hear.
Absolutely. Yeah, I actually joined the healthcare industry back in 1994. When I started in healthcare, I began as a registered nurse. I worked, I did my nursing practicum at a small county hospital in central Kansas, which kind of tied me, backstory back to the public health system. That's where I did my training. So I had a natural affinity towards public health. And, growing my nursing career, I ended up landing at a level 1 trauma center in Kansas City, where I spent about 12 years there practicing as an emergency department nurse before joining their implementation for their electronic medical record. In 2005, the organization was going through a vendor selection process where we were implementing an EMR, and I was asked to be part of that team. And it was pretty interesting switching from healthcare delivery, where I felt like I was kind of at the top of my game, having 10, 12 years in the emergency department, to a completely different paradigm where, I was getting myself involved into technology and, some data programming and just understanding the technology that goes into these sophisticated integrated medical records. And it scratched an itch that I didn't realize I had professionally. So, I spent about the next 8 years really heavily involved in the EMR world, working in various roles as, an application lead, really learning how to put together the EMRs. So, my clinical colleagues, had an intuitive workflow. And so I took a lot of pride in that. And over the past, over 8 or 9 years of doing that, I could quickly see that, all of this interactions that we were having with the technology that I was helping to construct and implement in these organizations was really creating a tsunami of data on the back end that no one at that time, this is late 2009, 2010, no one was really asking much about. There was a big movie that came out around that time, Moneyball with Brad Pitt, and and that was kind of the spark for me that said, hey, something's shifting in my industry, and I better get prepared for it. We had heard a lot of, when the Affordable Care Act came out in 2009, 2010, we had heard a lot about the shifting landscape in healthcare going to the value-based system versus the cottage industry or fee for service. And we didn't know what that meant, but I knew that at the end of that was they're going to have to get access to this data, really understand where our costs and where we're using resources in healthcare to treat our customers, treat our patients. And so, that kind of sent me down the path of starting to explore the data side of healthcare. And I did some training, quickly learned at that time that, having a nursing background in college didn't necessarily prepare me for becoming a very strong data architect or developer or anything like that. But it did give me, I was able to get deep enough in my education to understand a lot of the, the nuances about how data can be influenced at more the transactional level, and really start looking at ways to increase my literacy around data management and, how to really orchestrate a data program for healthcare that is driven by the technology it's already invested in. And so, over the last 7 or 8 years, data management has really been kind of the primary focus of what I've been professionally, trying to work with organizations on improving. And I've spent a little bit of time in the consulting world. During that time, really taking these organizations that have got very strong application level or back office type of reporting teams, and starting to shift the paradigm into more complicated data ecosystems where we're not just reporting from one individual system, right? We're taking data from multiple systems. We're aggregating it to platforms that we can start pushing that data out to our consumers. And that's where I feel like the fascinating change has happened over the past decade within healthcare, right? We were just entering into the 2010s, kind of starting our EMR journey, and then to round out the decade, we're in large part, we've got a lot of our healthcare systems and major faculty practices up on some type of integrated system, and being able to leverage that is kind of where we are today as an overall industry. Now, at Parkland, to answer the second part of your question, was we started our EMR journey way back in 1998. I think that was when we implemented the first components of our integrated health record, and then began just scaffolding on various components to get us to where we have a fully integrated system today. Unlike some of the other healthcare providers that are in the U.S. market today, who have done a big bang approach in implementing their EMRs, we took more of a systematic piecemeal approach, and and I think there was some reasons for that, but it did complicate the landscape. And so when I joined Parkland back in early 2019, we had a lot of the integration components built in. We had a really robust data program, but it was really kind of isolated to our IT division, and that's where we started focusing on trying to increase our literacy around our data community. Was this is what we can do, this is what we can produce, and really sharpening our position, working in more of a collective fashion with the business.
Got it. And so thanks for all that. There's a whole load I want to pick up on now on all those bits. So I guess first, just Parkland as an organization. I know they're a well-known organization, certainly if you're from the US. Just a little bit about them, what you do, and the background of the organization.
Yeah, Parkland, I'm the vice president and chief data officer. Parkland's been around for 127 years. We've had 3 hospitals. We are, over that time period, we are the county safety net hospital for Dallas County, meaning that we provide care for anyone, irregardless of their ability to pay, as long as you're a resident residing within the county borders. The most recent hospital that we built opened in 2015, and it's pretty magnificent. If you've not seen it, I would encourage you to go to the website. We've got images of the new building, but the importance of that building was that as they were constructing it, they had a lot of forward thinking related to constructing that building with the idea that technology was going to play a very key role. It's one of the most wired hospitals in the U.S. It's one most wired from HIMSS. On a couple of different occasions, but just that forward type of thinking that went into the planning, I feel like really showcases Parkland's stance on how technology can improve and really expand that human reach. And we opened the doors to our new facility in 2015, and it's magnificent. I can't even remember how many million square feet the building is, but the campus is consistently growing. We just recently opened up a new outpatient center for breast health to try to help improve the breast cancer screening and awareness for our community citizens of Dallas County, which we've noticed has had some higher incidence of breast cancer in the community. So, that was a response that our organization, really took seriously and built a building to help support that. So we do serve that community and very mission-driven folks there at Parkland.
Fantastic. Well, great. And the other thing I want to pick up on from your early in your introduction was You mentioned that your nursing background didn't necessarily put you in good stead for the work you've done in sort of architecture and data management. I was going to ask the question well, more posed, surely it will have, because lots of people who are in data haven't sort of been in the roles and the positions who are the recipients either of the value that's delivered by data or the insights themselves. So was that throwaway or genuinely, that kind of time in the front line, has that given you a better appreciation for the work, or actually, it was like a transplant, and you've taken a very different route?
Right. No, that's a great question. And I think what it allows me to do is, you hit the nail on the head. It allows me to provide a different perspective, right? I understand what's happening from a frontline healthcare delivery, workers perspective. And really, if what I tell my teams when they are, get frustrated that maybe a dashboard or a report isn't getting, some of the sorry about that. Some of the reception that it was looking for. It's more of, did you work with those providers to really find out what they need? If I'm having my providers ask me for something, that means that what I've produced for them isn't providing necessarily the value. But if you sit with them and start asking them, how would you do this? What problems are you having? You can start kind of designing solutions with their input that really provide benefit to them. And so, that's something that we've taken, that I think that I've brought in, to Parkland, that's pretty impactful from my background. I mean, I think the background in nursing lends itself to providing that type of perspective and just encouraging my teams to work more closely with operations and developing the solutions. Then it isn't an IT thing, right? It's a collaboration with your business stakeholder and not just an IT development.
Yeah, no, great. And does that suggest that data sits within technology in Parkland?
It does within Parkland. I've seen, from my consulting days, I've seen data set, in a number of different areas. And I'll be honest with you, I feel like when it sits within the IT division, what I tend to find, Jason, is that you have less of the bad behaviors that sometimes go with data sitting outside of an IT organization. And, I've been at organizations where each franchise, so to speak, or service line within a healthcare organization is able to curate their own software, curate their own teams, build their own teams, but there's no harmonizing around consistency. When the data is the data, you're all working from the same data set. But when it's centrally focused under an IT, you're able to put some IT governance controls around some of the processes that lead to really bad behaviors and eradicate that before it gets widespread among your organization. So we do have it sitting within IT, and I genuinely promote that type of infrastructure as it relates to your data program. It just makes it consistent and easier to manage.
Cool. And I guess overall in Parkland or in your previous experience in healthcare, where is the biggest opportunity, or where are some of the opportunities at least for data to enhance? And you've sort of touched on some as we've been going through a little bit about your sort of background and where you've come from and what Parkland does. But there's some like real hot topics in healthcare for data right now.
Yeah, I think, one of the things that I see happening widespread is there's the organizations that have invested heavily in their programs, and then there's some that haven't. And the ones that haven't invested heavily are starting to get further and further underwater. And what I mean by that is that right now there is a very, very hot market for the type of talent that it takes to build a program. And so now you see, teams, healthcare systems having to compete with like Google or Amazon and, Apple and some of the big tech players that are able to outpace our wages. And so, you're seeing a widening, gap in the industry just from a skill perspective of being able to build those type of resources internally. And so, it automatically puts pressure on organizations to come up with, well, how are we going to get this type of value built into our program? We know we've got to invest in the technology and the platform systems, but, are we going to be able to get talent to come in and work and help us, build the systems, maintain the system, connect new data sources? And I think, one of the things that we found hugely beneficial at Parkland that's continuing to promote our program and maturing it is, we work very heavily with our business leaders to drive that value and bring them to the table at every opportunity we can. And so I think, one of the things that I see happening is the shift towards virtual care, and having that tight relationship with my CMIOs and chief medical officers who are supporting these programs and the shift to virtual care. With that comes a lot of new data sources that are just unique to the industry. Thankfully, we've got a mature enough program that I can take the data that's being generated by these new platform technologies to support virtual care, and I can blend that with my historical electronic medical record data, and I can begin telling a story to my business or clinical operations folks that hadn't been able to be told before. Now you start to see that in other industry, in other markets where maybe their system hasn't invested as heavily in analytics, and that's essentially dark data that is never really getting back to the folks that can can provide value to. And so I think that's where what I'm seeing is just a wider disparity between the haves and the have-nots as it relates to data programs. And I'm just curious, how are you going to close that gap? How are we going to get across that chasm of getting those folks to the places that we've worked so hard over 6 or 7 years at Parkland to build? And that's disturbing to me, just at how rampant that is throughout the U.S. market.
I know there's some certain I suppose use cases within healthcare that data that you've been able to over the years bring together, clean up, make nice and ready for analytics or insight or reporting, or is there certain areas within healthcare that is more naturally lent itself to either patient care or back office processing or some financial management? Where has it enabled you to really help the Parkland business?
Yeah, I think some of that I'm gonna give you a little bit of an insight as to what happened during COVID, right? We had to engage our patient population in more unique ways than we hadn't done before, outside of a traditional hospital encounter. And I think, that's where I feel like technology plays a real value in both patient and provider, is being able to provide that bi-directional communication to your healthcare provider outside of a normal encounter. Right. And what I mean by that is when we had, as an example, we had to identify our risk patients, to get them signed up for the vaccine, right? We only had so many vaccines that were allocated to us. How are we going to reach the 1A patients and get them engaged, get them signed up if they wanted to for the vaccination? And, that's something that was challenging to do. We were doing what we could within our EMR system, but that would only reach a certain section of our patients. And so, we really had to start getting creative with the technology solutions that we had purchased and start creating survey forms that we could send out text messages, and really taking the data, stratifying the groups and saying, okay, this is the target audience that we need to reach. And I think, learning that lesson during the pandemic is really going to be a lesson that we take forward in being able to provide more precision care, population-based medicine, where we can understand what a cohort group needs and then be able to reach out and interact with them to guide them towards either therapies or inform them of information. And so I think those are lessons that we learned during the early phases of the pandemic that we're continuing to use even today and plan to use in the future, that I think really shows some exciting promise.
Did you find during that kind of period then, and this period that we're in now, that the pace at which you were able to respond, adapt, deliver on those things that you mentioned were made easier because of the investment that you'd made prior, or actually were these brand new implementations or sort of major enhancements that actually this was sort of a whole new way of thinking and doing things?
Yeah, no, I think there was a little bit of luck involved. Great question though, Jason. I think there was a little bit of luck involved in that, Parkland had made some investments strategically over the, past decade in the technology platforms that
Right.
allowed us to start aggregating several of our technology systems to that platform. We use SAP HANA as our logical data warehouse. And we started using that system way back in 2015. So today, I think we have over 200 sources of data connected to that platform. And so we had a lot of the blocking and tackling done for those systems that provide the value that we were just talking about to already connected. So when the pandemic hit, it was a matter of, okay, I'm not scrambling to get a new system plugged into my environment, tested, users authenticated, all of that other stuff that goes with, oh no, we didn't have something and we need it. And now we're in the middle of a pandemic, right?
Yeah.
So we had at least the basic blocking and tackling done. But what we didn't have was we didn't have a real tight working relationship with the business, but
Right.
we were already starting to develop that. So I think it was more, we were able to,
Accelerated it.
yeah, we were accelerating that program that relationship at the early phases of the pandemic, and it started paying dividends even still today. So
Yeah, it's really as I've spoken to quite a lot of people now in organizations who have obviously had to steer their way through this, and the pace of change has happened to, has almost in some ways happened to us all, and it
yeah,
was sort of a bit of, survive or die, fight or flight kind of time. But obviously those that have made even some investment and or even some investment in thinking, even if the
yeah,
doing wasn't there, they were really able to maximize their position,
yeah,
and either or protect their position or maximize their position in terms of what was coming at them, and not just in your sector.
right,
So it's really interesting to hear that your the almost the pandemic, the benefit, if you like, if I can call it that
yeah,
you got from
yeah,
the pandemic was an acceleration in relationship. It's sort of
it was,
not one I've heard, but that's brilliant, because we tend to see that it is these kind of relationships that exist that really allow you to get this benefit out. And one of the things I wanted to talk to you about actually was as how you make sure, and obviously your background in the front line, well, I'm sure has helped here, but
sure.
how have you made sure that you started to get the insights that you're creating, or data products or data even
Mhm.
into the right hands, and sort of so that the value can be realized from it.
Yeah, we have a very, very close working relationship with key stakeholders across Parkland. And so,
Right.
really, our organization is matrixed across, we've got EVPs, SVPs, and then, our service level kind of directors, and we all kind of tend to roll up under, one of the EVPs at Parkland, and
Right.
each one are in charge of certain strategic priorities. And so I think being able to identify those key strategic priorities, and then who rolls up underneath each group, and then identifying programs that are important to those key priorities is kind of key.
Mm.
And then those priorities would have goals associated with them that are measured, that are reported back to, our county board of directors, which is who funds Parkland. As a state county entity, it's not like we generate money and live off of our profits. It's, a lot of our funding comes from, county tax dollars or charity care or some type of, donation or of that type. So, we really have to be very targeted with what we're taking on from an initiative standpoint. And so those priorities have goals that get reported. So the data that these programs are run by is very, very critical. And so I think being able to establish those relationships early on in the COVID pandemic started just kind of building upon itself over the past maybe 18 months, to where those leaders that are in charge of the service lines understand the value that we can provide with our tools and our products. And so rather than it becoming a reactionary, oh no, I need to report these numbers to the board, it's been more proactive in that now we're able to see what's coming down the pike so we can plan better. We're not caught flat-footed with a lot of requests because we know that each one of these priorities have goals associated with them. So we can assign our team members to work with those key stakeholders to get everything fleshed out.
Yeah, at least then you know that the requests that are coming in are linked nicely back to, as you say, a goal and a priority. And have you found that there's been a big learning curve on the your business counterparts in terms of how they can use data, how they can use insights, the way they interact with you, the technology, your team?
Yeah, we actually, and that's a good question. Because everybody, tends to request what's seen right in front of their face. The command center, when we opened it during the initial phases of the COVID response, we built a big dashboard that essentially ran all of our command center operations. Right. Had a lot of key metrics across the hospital that showed, areas of impact with metrics. And so early on in the pandemic, everybody that was coming, to us was saying, "Hey, I need a dashboard." Not everybody needs a dashboard, as you know. Some things are tabular based reports. Some of it, we've got these sophisticated EMRs you can log into if that's where you spend the bulk of your day. It's about meeting your customers where they are and developing business personas around what their needs are. And so that's really where we started focusing on, who was that customer, what were they asking for, and what was the best tool to provide them, so that we weren't just consistently building dashboards when, a lot of times that isn't what was needed.
Yeah.
So it's really about really understanding the business persona and helping drive that value with the products that they are requesting.
Interesting. And have they started to put their own kind of initiatives in place to ensure that the rest of that department or people that interact with that strategic priority are sort of raising their understanding, their game in how data is used?
Yeah, they're, it's still a little bit in the infancy phase. So we're moving in the right direction though. So we're starting the conversations, at a higher level, and those are beginning to matriculate down to the lower level operational staff that are actually executing to these goals, right? The idea is that we want to implement something and then measure how effective that program is performing. And so we haven't gotten to the level where we're actually executing to create that feedback loop. But all the pieces are in place. So that's the nice thing, is that, we feel like we've built the right type of trust within the organization as it relates to the data. Now we're just looking at, how are we going to be able to consistently operationalize our, to meet these goals so that we can, create that feedback mechanism and understand that what we're doing is effective. And that's, I don't have any answers, but all the early signs are we put the right pieces in place.
Yeah, as you say, it's easy to say, but the feedback loop is important, isn't it? It's by doing the things that we're doing, are they driving the right actions and activities, and do those actions and activities drive the right result? And all of that feedback loop needs some element of data and learning and understanding so that you can, tweak.
Well, and I think that highlights that tight relationship that you have to create with the business, and, in building that trust and building that working relationship so that they can count on you and that you're consistently delivering. And then, and that's how you kind of build that team culture that gets people bought into the mission. And, I think I mentioned it early on at Parkland, we're very heavily mission driven, and that's the mission that we talk about, is that we know that we've got these goals. We know that we've got these key leaders that we're accountable to for the data and the results. And so, having that very tight working relationship has been very, very profound for us.
It's interesting you say about you're sort of very mission driven. Of course, as a care provider, that's not surprising, but I think that's your superpower. I honestly think that for people in data that have that focus on their mission, the alignment of the work that you do back to the goals, back to the strategic priorities that help you achieve your mission. Honestly think it's a superpower, because it's a lot of the work we do actually is helping people to unlock what are these use cases. And where you've got such a focus on a mission like that, I think it's something you can really use and empower people to get behind what you're doing.
Couldn't agree more. And I think, at the end of the day, it's all about the patient, right?
Yeah.
Everything becomes a zero-sum game when you put the patient at the center of the needs. And so, if I'm working on something that doesn't really impact patient outcomes, patient deliveries, something, then I probably ought to refocus on what I'm doing. And, that's been a very easy message to translate to my team, who, in the past 18 months has been locked into, a battle with, the ebbs and flows of patient volumes, of needs. I think you mentioned earlier, just being able to have agility and mobility in our data, is very critical. We're putting up these testing and vaccination stations and all of these things that are being put up in a day. And, being able to have that mobile footprint and being able to go out and set up a parking lot to funnel people through to get them vaccinated or tested is super important. And being able to take that data and then show that to my frontline leaders is even more critical. And I think that's where, overall as an industry we're heading, is being able to take that technology, implement it, and then use it quickly.
Yeah. One of the challenges we've had over here in the UK is the backlog of non-COVID related health challenges that now exist, and the time it's going to take to kind of clear that backlog down. And even though lots of people were told, still come and do your routine checks, and particularly if you have health issues, to kind of continue to engage with the hospitals and doctors and clinicians about those. People didn't, right, because of the pandemic. And so now there's a bit of a challenge. And I just wonder whether have you got some views on, how you use, data to help support, looking forward, and as COVID, I know you have some challenges in Texas with COVID anyway, but as start to come out of those challenges, how you maybe help to ensure that the right people get the right care outside of any kind of COVID related problems that you may have.
Yeah, we're investing very heavily as part of our program. Parkland itself is very heavily involved in what's called the community health needs assessment. And what that essentially boils down to is that, our board of directors really wants to influence the health equity in our community. And so, these major priorities and these major programs that roll up under the CHNA are designed really to deliver population and precision medicine based care. And what that means is that we have to understand what those community needs are and where their access points are to our facilities, because we want to make sure that those facilities are armed with, whatever they would need to treat those patients. And so, that's really where we are today is, we've got all of this historical information. Now let's start studying it and using it. And, at Parkland, we're fortunate. We've got a very strong data science program through our Parkland Center for Clinical Innovation that basically it's a large group of physicians that are teamed up with data scientists, some developers and data architects. But, that's what they do, is they look through our historical data, come up with data sets that may show impact for a community need, and then they work with us to get it in the right stakeholder hands. And so that's where I feel like the future is really is heading for us, is understanding what those community needs are and looking out at the 5-year plan to say, okay, we know that we've got a very heavy problem of pediatric patients, as an example, that are going to be coming from our children's facility in the next couple of years that are going to be coming Parkland patients. How are we going to address those needs of that cohort group before they get to Parkland, so that we're not treating their illness, but we're promoting their health equity? And I think that's where, understanding the needs of the community is where our data science team, working directly with our clinicians, have been able to provide kind of a future look at, okay, these are problems we're going to have to deal with in the next 5 to 10 years. And evidenced by, that's why we put up our new Moody Center for Breast Health. Was we did population studies and saw that there was a very wide discrepancy in breast cancer, early stage breast cancer for a certain population of our zip code. And so we said, hey, we need to address that need. It's a community need, and that's how that center was born. And so I think just doing more of that is going to be very key for the next several years in healthcare, but mostly at Parkland, it's very critical.
Yeah, brilliant. Well, I can't say that that's not a terrible thing to be focusing on, and I think that's getting the next 10, 20, 50 years right, and making sure you've got the right supply for the demand of service that you have, and do it in a, as you say, I suppose it lines with your virtual care as well as we've gone more digital. So fascinating to hear about your past, the work that you've done, and where the focus goes looking forward. And I massively appreciate you coming onto the show and sharing that with me and the audience. So really appreciate your time, Scott. Thank you so much for coming on.
Jason, I appreciate you having me, and hopefully your listeners gain some little bits of insight into the U.S. healthcare and data programs.
Yeah, for sure they will. So thank you again, and thanks everybody for listening. We hope you enjoyed this episode of the Hub and Spoken podcast, and we can't wait to share some more with you again soon. So thanks everyone.